Are you tired of the constant battle with sciatica pain that's stealing your sleep and limiting your daily life? In this video, I'll give you the ultimate guide to sciatica pain relief, especially sleeping strategies designed to bring you comfort day and night. I'll show you exactly how to sleep with sciatica. Imagine waking up refreshed and free of leg pain, ready to take on the day without the constant agony of sciatica. For many, it's a daily struggle filled with frustration and hopelessness. But what if there's a way to change that? With 30 plus years of clinical experience, I've seen these sleep strategies work for thousands of patients with sciatica leg pain and lumbar disc injuries. In this video, I will share practical tips and effective sleeping positions that have helped thousands of my patients improve their sleep and reduce pain. Not only will you learn practical and effective sciatica relief sleep positions, but you'll also discover how to manage your sciatica pain in your daily life with strategies like exercise, hot and cold therapy, professional treatments such as chiropractic care, laser therapy, and spinal decompression. In fact, stay until the end of the video and I'll reveal one of the most revolutionary non-surgical treatment methods that has proven effective for chronic sciatica sufferers who have tried everything else without success. You don't want to miss this part of the video. Hi, I'm Dr. John Zalanka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 30 years now. My YouTube channel focuses on helping those who've been suffering with chronic, debilitating back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs and surgery. I upload a new video every week. In addition to that, I've created a Health Vault. It's a collection of exclusive videos that get delivered to you each week with trusted health knowledge and lifestyle hacks. You can get it at the link in the pinned comment below. Now, the reason why sciatica is so debilitating is because there's so much pressure on the nerves that it causes intense, constant pain that can radiate from your lower back down the legs, severely limiting your mobility and your daily activities. But why does sciatica cause so much trouble at night when you want to sleep and when you need to rest? It's because lying down can put additional pressure on the sciatic nerve, making the pain even worse and making it difficult to find a comfortable position to sleep. So let's take a look here. If you recall, your sciatic nerve is a large nerve, but it's formed by the nerves that exit the lower back all the way down into the sacrum as well. All of these nerves form the bigger sciatic nerve, comes down the leg. It goes to all the things in that area, everything from obviously the leg and can cause the pain and the numbness and the tingling and the pins and needles, but will also can affect, when it gets really bad, affect bowel and bladder and reproductive organs and so forth. When we're sleeping, we're putting more pressure on this area. That's part number one. Number two is there's really no movement that's happening, so there's not a lot of blood flow to the area. Number three is a lot of the distraction has been taken away if we're actually sleeping, so we tend to focus on the pain that much more as well. So the sleep postures I'm about to show you are going to target these issues directly. They can literally be life-changing. So let's dive in. So essentially there are three different sleeping positions. One is not good for you at all. The other two we're going to go over in some detail. So number one, you do not want to be sleeping on your stomach. I don't care how comfortable you think it is. As unfortunate, what it does is it actually changes the curve of the spine. It puts more pressure through that area where those nerves exit. Unfortunately, not only will it cause pain in the back, which will then affect the nerves, which will affect the sciatica, it's also not good for the neck either. Because think about it, if you are sleeping on your stomach, then the head has to be turned off to one side all night long. Imagine if I asked you to walk around like this for 6 to 8 hours while you're awake, you'd understand you create some neck pain. Obviously, the same thing's happening while you're sleeping. But we want to stay off the stomach. It's not good for you. What we do want to look at is your choices are either sleeping on your back or sleeping on your side. So let's get to both of those as well. If we're going to be sleeping on the side, it is essential that we be using the right pillows for this as well. So again, you always want to sleep with two pillows. So pillow number one, you do need a proper pillow for the neck. So that proper pillow is one that's going to support the curve you're supposed to have in your neck. And when you're doing so, understand different people have different size necks and different shaped necks. The reason I like this particular pillow so much is it actually has different size and different shaped humps on either side. Your neck can go against this side, this side, this side, or this side. And we want that to be supporting the curve of the neck. Getting back specifically to sciatica, where the second pillow comes into play, is if we are sleeping on our side, we would come in and we would have the appropriate pillow for the neck. When we get on our side, we're going to make sure that the neck is properly supported. But then where the second pillow goes is we're going to take a second pillow. It does not need to be an orthopedic pillow. And we're going to put that between the knees. Now, the reason we do that is it is then taking some of the pressure off that part of the lower back. But what it's doing even more so is if there's no pillow there, the tendency is for this leg to then start coming over, which then starts to tense that nerve again. If we put a pillow in between there, it's actually helping to prevent that knee from coming over and that leg from putting pressure on the same nerves that then form part of the sciatic nerve. If we do that, we're going to find that there should be a lot less tension while we're sleeping. We should find that we're going to be able to wake more rested. Understand also, if the sciatica is coming down one side, then ideally you want that side to be the upside. If it's the downside, again, we're putting more pressure on the sciatic nerve. Last but not least, what we also want to look at is we want to make sure that our mattress is a proper mattress. So we always want a combination of comfort and support. When people are dealing with sciatica, it tends to be that they're more comfortable and not as supportive as they should be. So in a number of cases, this is again for another video, but you probably want to look at something that's going to give you more support, as opposed to the one that you're going to sink in and it's not going to really support the spine properly. And then the last option, number 3, is you can sleep on your back. So again, if we're sleeping on our back, we need the cervical pillow, the orthopedic pillow for the neck. And then what happens when we sleep on the back, what we're going to do is, again, we're going to make use of this second pillow. But now where the second pillow is going to go is it's going to go underneath the legs, the thighs, or the knees. And the reason for that, again, it's going to take some of the pressure off the lower back. It takes some of the pressure off the hip flexors. So your hip flexors become important because although they're called hip flexors, they also attach to the vertebrae in the lower back as well. And by doing so, again, we're relieving some of that pressure. And if we can have less pressure while we're sleeping, you should get a better night's sleep. You should feel less pressure on that sciatic nerve. It's something that you should actually be able to wake up and actually feel a little bit more refreshed in the morning. This is the exact approach that we take for all of our patients suffering with sciatica and other forms of back pain as well. Patients find tremendous results with this. It's something where the last thing in the world you want to be doing is to actually aggravating the condition while you're sleeping. Take, for instance, Stephanie. She really had chronic debilitating sciatica. We were doing absolutely everything right for her, but she would find every morning that she'd be waking up and it would be aggravated. And little did we know at the time that she was sleeping on her stomach. We switched her to this, and the improvement was incredible. The reason why this is so important is waking up in the morning with sciatica leg pain can turn your entire day into a struggle. When this becomes really intense, you're already dealing with enough. Last thing you need to do is to actually start from such a down position. I've literally had patients dread going to sleep because they knew how they'd feel in the morning. From the moment you get out of bed, the pain can make every movement difficult. It's going to affect your ability to walk, stand, even sit comfortably. And remember, it's not just the physical pain, it's also how that affects your mental health as well. Now, if you have chronic sciatica, while these sleep strategies are useful and helpful, you need next level strategies to start healing the true underlying cause of the sciatica in the first place. So here are some things that you can try. Obviously, there's still some debate about ice and heat. There really shouldn't be. And unfortunately, if you go online, they will talk to you about taking a warm bath before you go to bed. That might make you feel a little more comfortable temporarily. I'm a much bigger fan of ice. Understand with inflammation, with sciatica, we're going to get inflammation. You do not want to heat up something that's already inflamed. So you're going to take that ice pack and you're going to put it right on the area of the lower spine, the lower back, even coming out into the hip level a little bit, the area where those nerves are exiting the spine that are inflamed. You want to ice, we have what's called a 10-10 rule. So 10 minutes on, 10 minutes off, 10 minutes on, 10 minutes off. When you get tired of doing that, put it on for another 10 minutes. When you're using an ice pack, please be careful. We've seen people who have actually, frostbit their skin, where it becomes way too cold directly on your skin. But we've seen other people who use such a thick towel between the ice pack and their skin that there's really no cold coming through at all. So that's something that, we want a thin layer to make sure we don't frostbite the skin, but we need to feel the cold coming in through that part of the spine. And in fact, you can even consider sleeping on an ice pack. Obviously, it's not going to stay ice for that long, but at least it'll get to the start of your sleep cycle. Now, the next thing you should be looking at is there are exercises specific to sciatica. But again, this is where you really should consider some professional help or go to some of our videos. There is no one low back exercise for everybody. You might be surprised to know there's a different exercise for the lower back if you're suffering from a disc herniation versus if you're suffering from spinal stenosis. So when it comes to sciatica, what we're looking for, the two that I'd recommend, is what's called a piriformis stretch. So a piriformis stretch, you are basically, the piriformis muscle literally comes across the back here, and what it does is it attaches your hip to the spine. What you're doing is the nerve, that comes down the back, in about 80% of the cases, that nerve goes right underneath that piriformis muscle, and about 20% of the population, it goes right through that muscle. So if that piriformis muscle is tight all the time, then obviously that's going to be adding compression to that nerve. It's going to be pinching off that nerve, and that's going to add to your sciatica. So on a piriformis stretch, you actually want to stretch that part back there. The second exercise that I'd be looking at is, again, to stay really on the safe side, is something as simple as a pelvic tilt. Okay? And a pelvic tilt is a case where either the pelvis is either moving forward or moving backwards. Again, this is where proper diagnosis becomes important, because it's something where if you're suffering from spinal stenosis, for instance, that's causing that sciatica, well, then a movement that actually opens up those vertebrae is going to take pressure off that. If your sciatica is coming from a disc herniation, a movement that comes forward is actually going to put more pressure on that disc, which again will likely affect that sciatica that much more. Think of a disc herniation more like that sort of jelly donut. If I put a lot of pressure on the front of that, the jelly is going to squish out at the back of that. So we're going to want to look for exercises specific to sciatica. Please check out the links on my YouTube page. You'll see where you can get some exercise videos specific to sciatica as well. Now, there's going to be a point in time when you're going to want professional help. So ideally, I come from the world where, I want to be in optimal health all the time. It's something where you should be maintaining your spine, your nervous system. Again, for a lot of people, they want to just get over the hump. And so if your sciatica is bugging you for a day or two, then try these strategies to get you over that. If you find it's persisting for a week, or certainly if it becomes debilitating or causing a lot of disruption to your life, you need to get some professional help. And especially if the nerves ever get so bad that those same nerves go to the bowel, the bladder, reproductive organs, then that's immediate emergency help when you come to that. When it comes to professional care, there are a number of different options, obviously, that you can take. Obviously, I'm a big fan of chiropractic care, because if there's pressure on that nerve, what makes more sense than to take pressure off that nerve? So that's what chiropractic adjustments will do. A good chiropractor will look at all aspects of your care and your health. So number one, definitely needs to start with a thorough consultation, thorough examination. I definitely like to see x-rays. I want to know just how much degeneration's in the spine. I want to do orthopedic tests. I want to get to all of the underlying causes of your problem. That's incredibly important to do to properly diagnose, so then you can tailor a program specific to what you need. A lot of people go in for temporary relief, and then the problem is the condition is never corrected. Even if the pain gets temporarily better, what you're doing is you're actually allowing that to progress, and that's not good. It's the same thing when you turn to the drugs, the painkillers, the anti-inflammatories. Those are all good short-term, if that's what you're looking for, is a short-term relief. But understand that if you're masking the pain with those drugs, it's not just that it's not getting better, you're actually allowing the condition to progress. That disc, if it's a disc herniation, that can herniate more. If it's advanced degenerative disc disease, then that's going to degenerate more. That's not a process that stands still. That's an ongoing process that will get worse. That's why it's so important to get professional care. Chiropractic is excellent for that. Laser is excellent for that. We prefer the class 4 laser. It's the highest level of laser approved by Health Canada and the FDA. And what laser can do is everything from decreasing inflammation to the area. It can actually help to regenerate cells. It can actually help to increase blood flow to the area. At last count, there were over 900 different studies, scientific studies on the use of laser and certainly its benefits towards sciatica. I'm also a big fan of spinal decompression when done properly. This is different than traction or inversion tables. Don't let anyone tell you differently. If they're trying to tell you that, they don't understand what spinal decompression is all about. So again, if there's pressure on the nerve, what on earth makes more sense than to take that pressure off the nerve? That's what spinal decompression is supposed to do. Right? It was actually invented by Dr. Alan Dyer, PhD, MD, former Minister of Health for Ontario, so very much a Canadian thing. And essentially what we're doing is we're getting to the root cause. True decompression is going to cause that vacuum effect that will pull fluids and nutrients back into the disc. It actually allows discs to recede back in. You're actually dealing with one of the underlying causes of what's creating the problem in the first place. One of the favorite forms of care that we utilize in our center here is a combination of all of those things. So we have Ottawa's only non-surgical robotic laser spinal decompression. And what it really does is it, for the first time, combines spinal decompression with simultaneous Class 4 lasers. So Class 4 lasers, highest level of laser approved by Health Canada and the FDA. And the reason that we combine them, there's only 12 of these systems in the world. It's a patented, very unique system. If you haven't been specific to this system, you really have not tried this. Not the same as standard spinal decompression or traction or inversion. The difference is when you try spinal decompression on some people, what's going to happen is if we're trying to separate things that have been essentially squished together for years, the body's going to resist that. So obviously we're not going to get the same results. And not only it resists it, and it wants to go back to where it started. So with non-surgical robotic laser spinal decompression, what we're doing is at the exact same time that the spinal decompression happens, from underneath the system comes a Class 4 laser. Class 4 laser does a number of things, as we just talked about, but really two main things. Number one, it's going to ease up all those muscles while we're actually doing the spinal decompression. So we actually get true spinal decompression. It allows those nutrients to come in, rehydration of the disc. It allows fluids to come in. It actually allows discs to recede, which we've actually seen on pre and post MRI. It's really, really neat, the changes, and they typically happen pretty quickly. Most of our programs tend to be about 8 weeks in length, as opposed to the years that people have been suffering with things. Take, for instance, Fatty, mid-20s, a really nice guy, but back pain for 7 or 8 years. He loved to play basketball, certainly couldn't play basketball with sciatica and disc herniations and so forth. Got to the point where when there's that pressure on the nerve all the time, a lot of your energy is going to dealing with that. So he found his emotions were way out of whack, angry most of the time and so forth. Fatty went on our non-surgical robotic laser spinal decompression program. Tremendous results. He is now back to dunking the ball, enjoying life again. It's really neat to see people take such an interest in their health. But the change, again, this was a guy in his mid-20s. To know that you've changed this guy's life is just incredible. Now remember, implementing these sleep strategies can significantly improve your comfort and reduce pain at night and also during the day. However, if you have chronic sciatica, it's crucial to address the root cause with treatments like chiropractic and robotic laser spinal decompression. If you found value in this video, please like and share it so others who need these tips can benefit too. I'd love to hear about your sciatica struggles. What have you tried to relieve your pain? What worked for you? What didn't work for you? Give these sleep strategies a try and let us know how they worked for you. Let's support each other and build a strong community where everyone can find comfort, reassurance, and support. Your comments and stories matter. Now, the next video you should watch takes you through a step-by-step non-surgical treatment protocol for conditions like sciatica, disc bulges, and lumbar stenosis. Don't miss out. Watch it now for effective relief strategies.